The goal of this podcast is to help you break in and thrive in advertising and marketing. Welcome back to our brand side segment where we're not talking to agency professionals. We're talking to the people that professionals report to. In this episode, we have on Dorothy Gemmell. She's the chief commercial officer and president of GoodRx. And she shares how the brand has become a trusted leader in healthcare affordability, offering lessons in building consumer trust and brand love. We recorded this in person at the Havas, New York office during their GLP-1 day. They have a website that I'll put in the show notes about their learnings from GLP-1 day, but this is a healthcare focused episode. So I'm not an expert, but one thing that I can do, because I have Google pulled up right here, is tell you what a GLP-1 is. It's a hormone that helps regulate blood sugar, appetite, and digestion. The first thing that comes to my mind is the Ozempic. I don't know if we can say that. I'm saying it now as one of the brands that comes to mind. I'm not an expert, I'm not paid endorsed by Ozempic, but there's probably some other drugs out there. You've heard of it, you know what it's doing. So we're going to talk with Dorothy about a little bit about Ozempic and how it is affecting their vision and their game plan at GoodRx. Um, Overall, we'll talk about her journey, her highlights, the importance of cross-functional expertise in sales, marketing, and branding to create impactful strategies. She's going to provide advice navigating regulated industries, leveraging social media, join cultural conversations, and creating brands that resonates with consumers. You're going to love this episode. It's quick. If you're interested, there's a whole landscape about this. Let me know if you want to learn more and we can talk more about this stuff. You're going to want to connect with Dorothy. To do that, connect with her on LinkedIn. And if you like what you hear, please give us 5 stars on Apple Podcasts. Write a nice written review. Go to Spotify, leave 5 stars there. That helps us continue to get amazing guests like Dorothy. Now, on with the show. This is the Breaking and Entering BrandSide podcast. And as usual, I'm your accomplice, Gino Schellenberger. Kick it, Mikey. Welcome to the Breaking and Entering Advertising podcast. We might have to start up like a health segment of this podcast. Would you want to be the host of that?
You might. I might, but I think you're going to be better at that than I am. But thanks for having me today. Really excited to be here and share some of my stories and my opinions on great brands and great advertising.
Yes. And I think we have to acknowledge that we're behind the scenes here at Havas, New York's GLP-1 day. So we're excited. You're speaking, I'm assuming, main stage in a little bit. So we'll be excited to see that.
Yeah, no, thanks. I am. I'm really honored to be here, honored to be a Havas alum. I think that's one of the reasons that the team asked me to come back, but also working at GoodRx because obviously affording GLP-1s is part of the conversation. There are so many people paying cash for GLP-1s, and the category is completely transformed what I'll call the prescription drug business, but it's also transforming everything from retail, like think Walmart, grocery stores, etc., food manufacturers, the Nestle's of the world, and then even OTCs and supplement makers. It's kind of changing everything.
Absolutely. And we can definitely get into more of that, but really let's back it up and let's talk about who you are and what you're up to today with your current role. So give us some context here.
Sure. I'm the chief commercial officer and president at GoodRx. GoodRx is the #1 platform for Americans for healthcare affordability. So GoodRx is 12 years old. People come to us, about 1 in 4 Americans come to us each year looking for savings, affordability, and access options for their medications, mainly prescription medications, both generic and brand name drugs, but also increasingly even OTCs. We can talk about that in a few minutes. We just launched a new e-commerce partnership with O-Pill, the first over-the-counter birth control pill, and also even pet medications, because people still need to save money on their pet medications as well.
Do you have any pets?
I have a cat.
Okay.
Yeah, I'm not so excited about my cat, but that's okay. My cat's fine. My kids wanted the cat. Cat's not.
Oh, you're not so
Cat's not. Yeah,
excited.
I'm not excited about the cat.
Oh,
My
come
kids
on.
want the cat. It's 9 years old. Who takes care of it? The mom. But anyway, at GoodRx, I head up our kind of go to market, sales, account management, and B2B marketing.
Okay.
There's another team that has focuses on the amazing, brand of GoodRx, which has a
Mhm.
lot of brand love, which is something I'm really proud of. I'm really lucky to be working yet again in my career for a brand that people, when you go to my test is you go to a cocktail party or meet somebody and they say, where do you work? And you say GoodRx, and there's a smile comes to their
Mhm.
face and they're excited to tell you their story about how it saved their mom 80% of their medications.
Right. Right.
Yeah.
Yeah. It's a direct impact, like helping people directly. Like that's incredible. How would you define the brand today? And when did you start?
Just about 18 months ago.
So
So I
yeah,
can't take credit for the
sure.
amazingness of the brand.
Yeah. But what'd you walk into? What drew you
Sure.
to it? And what was that brand?
Sure. So I think what I can focus on to answer your question is um, I was brought in to start to build out and expand a part of our business called Manufacturer Solutions, which is a bad brand name, but it's focused on pharmaceutical manufacturers, over the counter medication manufacturers, medical device manufacturers. Because traditionally, GoodRx was focused on helping patients save up to 80% on their generic medications, and they were doing that for a decade. But what we learned as a company was the consumers that come to GoodRx and their doctor writes them generic atorvastatin, and they're like, great, I can get it for $19 and save a bunch of money. But then their doctor also writes another drug like a GLP-1 or a diabetes drug that's a brand name drug, and they'll come and they'll say, wow, it's $500, it's $1,000. So for us, it was a bad experience for consumers because they would bounce, right? They would be like, wait a second, why am I saving so much money here and not on this? So we started up a division, which I work on, in helping drug manufacturers surface their savings programs for consumers. So today they have copay cards, they may have patients assistance programs, they may have a talk to nurse function and other things. We can bring that all of those savings and affordability solutions that the pharmaceutical companies are offering anyway, and put it in front of these thousands and tens of thousands of consumers that are looking to afford their medications. Today, pharmaceutical companies put it on their brand.com, right? And they mention it on their TV commercials. But the awareness of the average US consumer as to all these savings things for brand name drugs is less than 10%. So that's the part, I'll call it the B2B part of our business that we've been building. We've been building our brand around it.
Okay, good to know. So what's been the founding strategy for this B2B marketing? What are you implementing?
Sure. So, a couple of exciting things. So, number one is we are implementing what we're calling integrated solutions. So, today, a pharmaceutical company might have a copay card for their medication, which might be an actual paper coupon at the doctor's office. Maybe it's something you can find on the brand.com a few pages in. We're actually integrating it into the GoodRx experience. So, the GoodRx user, the same one that's saying, hey, I've got a prescription for generic atorvastatin and brand Jardians and this, they can live in the same environment that they use and trust all the time and download their coupon to save all in one place.
Nice.
And what we're seeing is super high engagement and also high utilization by the patients, which obviously benefits the manufacturer.
Gotcha. Love
I
it.
would say one more thing that we're innovating as well is pharmaceutical manufacturers are leveraging our platform to actually set and offer a cash price for their drug. One of the most common was last year, Lantus, which is an insulin for diabetes, offered anybody, whether they're regardless of their insurance status, that had a prescription, the ability to buy Lantus for $35. As much as that sounds really simple to do, a drug company can set the price at $35, but you may have Cigna insurance and your copay is 50. I may have Aetna or Optum insurance and the drug's not covered, or it's $99 for me. This way you and I could actually access the $35 price using the GoodRx platform, which we call is a point of sale cash buy down. So that is maybe not cool as it sounds, is a really big innovation. We now have over 70 brands doing that and helping patients afford their medication and save money.
Incredible. Incredible. I wanted to ask about the impact and like a little bit of probably what you'll be talking about or we'll hear about today with GLP-1s. How do like this innovation and this change, how can this impact other industries? And what's your take on this?
Sure. So the impetus of the GLP-1s, again, GLP-1s, which have been taken for diabetes for a very long time, their use and proof in use of weight loss has really accelerated, in my opinion, that a lot of changes in the industry and how brands in general are going to market. I would also say too, what's really interesting here too is the patient is mainly the payer here. So it's that rise of the consumer perhaps versus the patient. Consumers want to access these medications. They are going to their doctors and asking them for it. We're seeing a rise in, the hims, the hers, the rows of compounding pharmacy, subscription, weight loss products, and other things. But it is definitely impacting, as I mentioned before, kind of what I'll call health e-commerce, the rise of cash pay because people want it. And if most of the time, I think there's only about 10% coverage of these drugs for weight loss.
Okay.
Insurance, isn't paying for it. So if you choose to use these medications, you are paying an average price is $800 to $1,000 a month.
Wow.
It's not cheap.
Got it.
At all. So, but those patients who are stepping forward as consumers and purchasing these medications, again, with a prescription, or also think about it, are changing their lifestyle. So as I mentioned before, they're buying different kinds of foods because their appetites have changed. They are requiring different exercise regimes. So that impacts the exercise fitness industry.
Sure. Yeah.
I've even read articles, as you have probably too. You've even seen like airlines saying they're going to save money because people weigh less, and Walmart worrying that people are going to buy less food. It's impacting a lot of different industries all at the same time. But it's a really interesting time for brands, I think, in healthcare because traditionally people didn't talk about it. My section of the meeting today is called the social pause, and it's talking about social media as a channel for how I think both in GLP-1s, and I would also say, and maybe because it's targeting me, menopause is having its moment in social media. So whether it's TikTok videos, whether it's Insta, Facebook, whatever channel you want to talk about, X, there are more and more consumers, healthcare professionals, and I think an opportunity for advertisers to be part of the conversation around these drugs. And I think for the first time, it's really accelerated that platform and discussion.
Interesting. So then what would your advice to maybe brand marketers out there, like, should they engage in this? Should they acknowledge this? Should they should they enter the conversation if they're a brand that's not directly involved?
So that's a good distinction because the brands that are not prescription. So you've got the right, because prescriptions are regulated. We all know about that. But for the other brands, there's a tremendous opportunity, whether it's through influencers or other types of things, to join the conversation and also to be supportive of a huge population that's on these medications. And also, frankly, trying to stay on the medications. The side effects the first 3 to 5 months are not pleasant. And you have to get through that. Yeah. You're seeing a lot of OTC manufacturers. I think it's an opportunity for brands to be empathetic that, hey, you're on a GLP-1. We know how you might be feeling, whether it's digestive, headaches, all sorts of kind of side effects that they have to manage. Might be an interesting way to
got it.
To focus on that.
Yeah. Interesting.
You're thin. You don't need to take these drugs. Oh. Some people liken it to feeling like you have morning sickness for 3 months.
Really? Yeah, I could see like a Dramamine or I don't know, another like a Pepto-Bismol.
Sure. And then there's opportunities for vitamins and supplements because you need to be taking those too.
Yeah. And then like what about like clothing brands potentially
entering
the conversation? Is there any like best practices or is it still like undiscovered, uncharted territories.
Well, I'm sure there are a lot of best practices and a lot of folks that have way more expertise
Sure.
than I do on the area. So probably not my area
I
to
know.
focus on.
I'm just, you know, I
I'm
worry.
a social media user. I'm a target, not
Yeah.
necessarily a.
Yeah. It's, you know, sometimes these best practices are figured out from mistakes. So I hope we can get ahead of those and like mitigate that. So we will find out more. So then remind me again. So how is GoodRx like evolving with the GLP-1s? What's the strategy now?
Sure. So a couple things. And again, I think it's less about exactly the GLP-1s, but more around accelerating some of our technology investments and how we've kind of expanded our platform. So as I mentioned before, one of the things that we just introduced was an e-commerce capability. So traditionally, GoodRx has been a place where you can go and download a coupon, take it to the pharmacy, or bring your, a lot of it's mobile, bring your coupon on your phone and save money on your prescriptions. So it's very much been do that, go to the pharmacy. So we have increasingly expanded our tech platform to allow for example, e-commerce. So our first e-commerce partner was Opill, which is also the first over-the-counter birth control pill for women. So kind of a couple of firsts, which is exciting. So that platform, and I'll get back to the GLP-1s, as much as Opill's the first to use it, the application for the GLP-1s and other medications is you're seeing this direct to consumer flow. I don't know if you've heard of Lilly Direct or Pfizer for All. It is where the manufacturers are actually trying to create a frictionless or seamless path from, hey, I need the drug or I want the drug, to seeing, let's say, a telehealth visit, seeing a provider, that provider writing the prescription, that prescription either you can pick up at the pharmacy or better yet, it's now delivered to your door. So that end-to-end healthcare flow is becoming more and more popular. And we are a platform that's enabling all of it. We are not the pharmacy, we are not the front end, back end, but people are increasingly using our platform for that. So I think the GLP-1s kind of started that, and now others are coming on board too. Biogen, that makes a drug for postpartum depression, also recently announced this flow of, I need something, I can talk to a healthcare professional, and then I can get it delivered. So imagine if you're a couple weeks after having a baby, do you want to go sit in a doctor's office and wait on, do you want to go then talk to somebody in an office? Do you want to then drive to your pharmacy? So this whole idea of making it easier, and whether it's that incidence or whether it's a young, busy professional, or whether it's my grandma or your grandma or parents who it's hard for them to do that. I think what the GLP-1s are accelerating is this push to make the entire end-to-end flow seamless. And that is what we've been focused on. The last thing I'll mention is another piece. It's a little more B2B geeky-ish, but if you're a healthcare geek like I am,
bring it on.
Is we're also starting to use our platform to help people see inventory. So we did this during COVID. It's becoming more and more important. We have partners that are retailers. So think about this, the ability to know whether the drug is in stock. It's
Makes
definitely been a challenge with the GLP-1s. There's been shortages. I personally have had friends that have been on it for 5 weeks, and all of a sudden they're like, I have to go to 3 pharmacies because nobody has it. So, and you have to get your prescription transferred, et cetera, et cetera. So this whole concept of, we are also building our platform, which will help GLP-1 medications and others to be able to actually know if it's there.
Got it.
And you can think of all the use cases, including just being busy, that if you're going to go to the pharmacy with a prescription, you want to know that the drug's there so you don't have to come back.
Got it. Understood. The final question is, more so in the breaking entering, like for the aspiring marketers out there, I guess, what advice would you give your younger self if you can talk to somebody today or entering this industry? What's something you learned that you can share?
Sure. And I have learned a lot in the almost 35 years I've been working. So if I look back to my younger self, I think the things that I feel I did right is I I took a lot of um, opportunities, obviously both sure to move on to other, move on to get promoted, but I took a bunch of lateral moves. I moved it from sales to sales management, but then I made a choice that I did want to understand marketing.
Mm-hmm.
And so I took a lateral move to be a product manager and learn marketing and do marketing, and work with highly experienced marketers.
Yep.
I would say the same things. I think I've always been I was started my career, I was being in sales and sales management. Then I became a sales and marketing
Mm-hmm.
kind of gal. And even I spent 10 years at WebMD and Medscape, moving to work at Havas, where we've both been alumni, to run an ad agency, to really understand kind of the background of building brands and positioning and strategy around that, was super, and the creative process, super helpful. So I guess my advice to my younger self, I'm glad I took those moves to learn more across the spectrum, as opposed to if I just stayed in kind of sales and sales management my whole life. I'm happy I did that. My advice I would give my younger self, because I did work a lot and worked a lot of hours, is make sure you take time for yourself and develop yourself outside of work as well.
It's important. Amazing. How can people reach out to you if they want to say hello or learn more?
Sure, absolutely. Probably best way is LinkedIn. I'm Dorothy Gemmell at linkedin.com. So definitely connect with me, tell me your story, and thanks so much for having me on the
Amazing.
show.
Thank you so much, Dorothy. Great job.
Thank you.